oceans apart, and you curl up to our little one. You are the spot.
Hi, folks. Thank you so much for joining us today for this, our 18% and growing campaigns briefing with City Council on funding to our diverse AAPI communities. My name is Vanessa Leung, she, her, hers. I am co-executive director of CACF, the Coalition for Asian American Children and Families. Turn it over to my co-ED, Anita.
Hi, folks. My name is Anita. I am also co-executive director of CACF. And again, welcome to you all. So many of our members and partner organizations, as well as council members and staff of council members who are joining us today for this very important briefing for our community. CACF is a policy advocacy organization. We bring together the voices of youth, of community members, of CBOs, community-based organizations that are AAPI-led and serving, Asian American Pacific Islander led and serving. We bring together all of these voices to together create equity, fight for equity, and create agendas that can really look to making our systems better so that we can serve our diverse communities and populations and meet our needs. And so we're so thankful for you all to be here today to really dive into what we've prepared together through our 18% and growing campaign. We actually started many years ago. For those of you who don't know, I think, Vanessa, it was 10% and growing. And so today we are 18% and growing, and we'll kick it off to Lakshmi Shanmuganathan, who is a coordinator here at CACF, who's been working so hard on 18% and growing with all of our partners. And really is a wonderful champion for our communities, along with many who you'll hear today. So Lakshmi.
Hi, everyone. It's a pleasure to see so many familiar faces and also some fresh faces here. We greatly appreciate all of you taking the time to join us for this briefing today. Just to share a little background about the 18% and growing campaign, we are a budget equity campaign that actually unites over 50 and close to 60 AAPI-led and serving community-based organizations across all 5 boroughs of New York City. And we come together every single year to fight for a fair and equitable New York City budget. And as Anita said, we started out over a decade ago as the 10% and growing campaign and have evolved into the 18% and growing campaign, which is really representative of the fact that the AAPI community comprises 18% of New York City's total population. We are the fastest growing community in New York City, New York State, and now the country. And we are also the fastest growing voting population in New York City and state. So our campaign name really speaks to, the vast growth and diversity and dynamicism of our community. Our campaign members, serve hundreds of thousands of New Yorkers and employ thousands of New Yorkers every year. So we're really proud and excited to come together with all of you today to partake and be a part of this briefing together. And we have a lot of fun activities planned today in our agenda to really shed light on the AAPI community's history, struggle, and continued advocacy for equitable funding in New York City. And so the first thing is we have a Schedule C presentation about, New York City's Schedule C budget and its allocations to the AAPI community. Then we'll shift gears to hear from our AAPI organizational leaders and a panel discussion. And then we'll have borough-specific breakout groups where groups and elected officials will have an opportunity to come together to meet and plan within these borough breakout rooms about how to build a more inclusive New York City for all. And then lastly, we'll wrap up by sharing some exciting announcements for CACF and 18% and growing moving forward. But before we get into the Schedule C presentation, and while I have so many faces on, I wanted to shift gears and ask if people could turn on their camera so we can take a group photo. I see so many cameras on. Thank you so much for collaborating on this. I appreciate it. And I think I will count to 3, and then on the count of 3, our CACF staffers will be taking photos. So smile wide, everyone. Okay, go 1, 2, 3. We'll do it again. I guess we can just keep smiling. Okay, I think that's probably enough. It's probably an awkward amount to smile that long. And now we can go ahead and get into our Schedule C presentation. So each year, a key component of the 18% and Growing campaign is that we come together to conduct an analysis of New York City Council's Schedule C budget and its allocation to AAPI-led and serving organizations. And so we want to share some of our key findings from last year's Schedule C analysis. This first chart shows the annual funding trends towards AAPI organizations and the Schedule C budget. So this graph is showing 12 years of discretionary allocations that are dedicated to AAPI organizations each fiscal year. And what we see is over the past decade, there's been a steady increase in funding that's allocated to AAPI organizations. And that really speaks to the work of our advocacy, both our campaign members and our elected allies who've worked really diligently to make sure that our groups and more groups are included in the Schedule C process and are equitably funded. So we're really grateful to see this steady incline over the past decade. I will note that there was a drop in funding in fiscal year 2021, and that was largely due to the start of the pandemic, which created a budget deficit in New York City and led to budget cuts in Schedule C overall, which impacted our communities and many other communities like ours. I will also note that this chart shows the initiatives outside of the AAPI Community Support Initiative, which was created last year. And so this was a $4 million initiative that our groups really came together around to support and advocate for the creation of. And thankfully, because of our champions in City Council, we were able to successfully push for the creation of this initiative. And that initiative actually more than doubles the amount of funding that's going to our communities. So last year, without that new initiative, our communities received roughly $3.9 million. And now we are closer to $8 million total. So we're deeply, deeply grateful for the creation of the AAPI Community Support Initiative, but it's also something extremely vital and critical for our communities and a step forward in the right direction towards increasing access and equity for our communities. So it's very important for us as we're advocating this year that we're pushing for this new initiative to continue to be sustained and hopefully enhanced so that we can include more groups into this funding process and support the vital work that they're doing on the ground. This next chart is breaking down the percentage of discretionary funding that's allocated to AAPI-led and serving organizations compared to our AAPI population growth over the past 5 years. And what we see is that there's still a lot of work to be done in terms of increasing access, equity, and inclusion for our groups. While we've steadily increased in population growth over the past 5 years, we're now 18%. And a decade ago, we were, I think, 12% and growing, yeah. Despite that, in the Schedule C, we see that we receive fluctuating amounts of support through Schedule C, and that means that every year the percentage of funding that we're getting is not necessarily increasing. It's actually been decreasing over the past few years. For instance, we only received about 4.46% of the total Schedule C funding last year. And so there is this large gap still in terms of representation and the need and support. And that's why we still come together as a campaign to advocate for budget equity and inclusion. This next chart is breaking down the funding trends by AAPI organizations. So this is showing the total number of AAPI-led and serving organizations that are funded in Schedule C annually over the past 7 years. So last year, fiscal year 2022, we saw a total of 86 AAPI organizations funded, and that was a net increase of 3 organizations. Actually, there were 12 new organizations that were incorporated into Schedule C last year, but there are also 9 API organizations that didn't receive funding that used to, and so that's why it's a net gain of 3. And then another part of the Schedule C analysis that we really look and break down is funding by borough. So this graph is showing the total allocations to AAPI-led and serving organizations across all 5 boroughs of New York City. And when we analyzed these numbers, we actually saw that there was an increase in funding for AAPI groups across all 5 boroughs. And then there's also an increase in terms of the number of AAPI groups that were funded in each borough, with the exception of the Bronx. All other boroughs saw more groups included into the Schedule C discretionary process last year. So that's something that we're really grateful and proud of. And I also wanted to note that in Staten Island, for the first time, we saw 2 AAPI groups funded, which is the first time that groups in Staten Island were funded. So we're also very proud and thankful for that. But when we look at these numbers more closely and we break down the percentage of funding for each borough versus the percentage of representation of the AAPI community across each borough, we see that there's still large disparities across the board. For example, in Queens, the AAPI community represents roughly 30% of Queens' total population, but we received about 8.13% of discretionary funding last year. And then in the Bronx, the API population comprises almost 6% of the borough's population, but we received less than 0.1% of the Bronx's discretionary funding. And so across the board, there's still this gap and this disparity in terms of inclusion. And so this is what we continue to fight for. Another aspect of the Schedule C analysis that we look at each year is the history of funding by council member and council district. So this chart is showing funding trends in council districts with the highest levels of AAPI representation. It's in descending order. So this is the top 15 districts with high AAPI representation. We see that District 20, previously Councilmember Ku's office, has the highest level of API representation at 68%. And then it goes all the way down to Councilmember Rivera, whose district has 17% AAPI representation. And we're comparing out the level of API representation to the percentage of funding that's allocated to API communities in each of these districts. I also wanted to note that we bolded all the council members that have left office over the past year. This is analyzing last year's budget. So we bolded all these council members because we know that there has been changing leadership across a lot of these districts, actually most of these districts. So it's a very critical time for these districts and for our API communities within these districts. And I also wanted to note that in our Schedule C report, we actually have this funding analysis for every single council district. It's just for the sake of cleanliness in this presentation, we just wanted to spotlight the top 15 districts with high API representation. And then this chart is taking a closer look at these council member districts and looking at the total discretionary funding that they allocated to AAPI organizations over the past 3 years. We have this history, I think, of their funding going back at least 5 years. I really wanted to look at the past 3 years because it's been, a very tumultuous and unique time given the pandemic. And so what we've seen is that there have been fluctuations in funding through the years, but there are a lot of council members that have actually steadily increased their funding to AAPI-led and serving organizations over these past 3 years. That includes Councilmember Chin, Councilmember Gennaro, Councilmember Brannon, and Councilmember Rivera. So we're really thankful for their close partnership and allyship with the 18% and Growing campaign and for the groups who comprise this campaign. But there have also been some council districts where we've seen declining support in terms of funding. And so that's something I just wanted to note. And then this chart is taking a closer look at each of these council districts with high API representation and really comparing the rate of representation to the percentage of their discretionary pot that they allocate to the API community. And what we see is, with the exception of Councilmember Chin and Councilmember Rivera last year, that there were large disparities across the board. And so there's still a lot of room for growth in terms of partnership and understanding of the needs of our communities. Most of these council districts, despite the fact that they do provide some level of funding or support to organizations, could still be doing a lot more. I wanted to point out, Councilmember Koo, who has provided some of the most discretionary dollars to the API community, also has the largest, represented the district with the largest API percentage. But if we look at the numbers in terms of representation, the API community comprises nearly 70% of that council district, but Councilmember Koo, I think, gave a little bit less than a third of his funding to the API community. And so there's still a lot of room for growth across all of these districts. These were just some of the snapshots and highlights of our Schedule C analysis. We have a more detailed and much longer report that we are publishing on our website, but I'll also be sharing with you these presentation slides and the actual report for all of you who participated in this briefing today. But I wanted to open the floor to see if anyone had any questions or clarifying questions. I'll also note that on the screen is my contact information. So if anyone does have any questions about the Schedule C analysis, the actual report goes into more detail about all the groups that are funded in each borough, and then the history of our group's funding. So I invite you to reach out to me if you do have any questions. And now we can shift gears and hear from our community partners who can really, provide on the ground context to some of the challenges and what we're fighting for as a community. Before we start our panel discussion, I really wanted to ground the conversation and contextualize it by saying that there are diverse and expansive challenges that are facing our AAPI communities across the board and in all boroughs of New York City. Many of these challenges, including increased rates of poverty, food insecurity, housing needs, questions of education access, health access, language access, violence intervention and prevention. Many of these challenges have been exacerbated during the pandemic, but have existed in our communities long before that. And what we've seen in our communities is that oftentimes our most vulnerable community members will turn to and heavily rely upon our community-based organizations as a lifeline for support. And so oftentimes our community-based organizations are asked and expected to fill in gaps of services by providing culturally relevant and language accessible services that are oftentimes the most effective in understanding and addressing the needs of our communities. But despite the critical role that our CBOs play within our communities and the larger fabric of New York City, our groups have yet to receive adequate and equitable funding to really support the vital services and programs that they are continuing to provide. So today we want to hear from 6 organizational leaders within our AAPI community who are doing important work on the ground and can really speak to the challenges that our communities are facing when trying to access equitable funding in the city. And I want to kick things off by passing the mic to Jennifer Sun, who is the co-executive director of Asian Americans for Equality. And I think Jennifer can especially, help contextualize, the level and diversity of needs that our communities have experienced and faced, especially over the past 2 years, and also the level of needs in our boroughs.
Thanks, Lakshmi, and it's great to be with all of you today. I'm Jennifer Sun, co-executive director of Aapi. I'll share a little bit about our experience in responding to the COVID pandemic, just as an example of how our organization has had to respond to new and heightened needs in our community that I think is very similar to all of the organizations that are here today. So our organization has been in AAPI immigrant communities across the city for almost 50 years, primarily providing affordable housing, small business development, and immigrant services. But in the through the pandemic, we've seen a greater demand for affordable housing, eviction prevention assistance, small business assistance, and accessing essential healthcare services and social services. In addition to really new needs, because so many families have been impacted by the economic impacts of the COVID pandemic, losing income, losing wage earners in their households that have really pushed them to the brink of homelessness and persistent unemployment. So as a result, we're seeing in the AAPI immigrant communities, families struggling to meet just basic needs. And what that means is that so many of our organizations have had to now quickly stand up food pantry programs to address a growing epidemic of food insecurity and hunger in our communities. In addition, they've continued to face barriers in accessing COVID testing and basic healthcare. Asian American families disproportionately live in multi-generational households, more so than any other racial or ethnic group. As a result of living in multi-generational households where typically parents are living with grandparents, grandchildren, and other extended family members, they are living in overcrowded housing conditions. So we have Asian American low-income renters, for example, who are experiencing a very high rent burden, where almost 50% of Asian American families are paying over 50% of their household income on rent and utilities. And that's exacerbated by their concentration as essential workers and working in particular industries that have been adversely impacted by the pandemic. And so a disproportionate number of Asian American immigrants work in healthcare, hospitality, food retail, service industries. Women in particular have been essential workers on the front line, but they have been impacted by the economic impact of the pandemic, losing jobs at a higher rate and facing greater barriers in being able to access unemployment. So altogether, the loss of income, living in multi-generational households, living in overcrowded housing and often in illegal conversions, such as basements and attics, have all contributed to a disproportionate health impact and infection rate and even death rates in our communities that we are still trying to help our communities overcome. So what we're facing ahead of us is a longer and more protracted recovery for our communities. That because of all the barriers that we've described and the expiration of protections for low-income renters, like the expiration of the eviction moratorium, the ending of emergency rental assistance, the exhaustion of excluded workers funds and in providing emergency cash assistance, the loss of this income support and housing protections will continue to further jeopardize our families and their ability to recover. So we are seriously facing a risk of homelessness and persistent unemployment that requires a greater level of funding, support, not only over the next fiscal year, but a sustained commitment from city government in supporting our communities to make sure that they are not left behind. So I'm going to pass it to my colleagues to continue to describe, in particular, the need for additional resources in our community, and also has organizations, we also need further support in getting funding to smaller organizations directly, and in further streamlining the contracting process so that as organizations, we have the financial health and ability to serve our communities without being jeopardized in our ability to remain financially viable. Thanks.
Thank you so much, Jennifer. I really appreciate you contextualizing, the level of need in our communities, and also, the importance of this need for long-term healing and recovery that we're seeing across the board, that the issues that, have existed before the pandemic, that have been exacerbated during the pandemic, are sadly not going away anytime soon. And so we're continuing to do this work, and we need support to continue this work. I just wanted to flag for everyone here that if you have any questions about, anything that we're discussing during this panel, please feel free to mark them in the chat, and hopefully we'll have time at the end of this panel discussion to address some of these questions. But now I wanted to pass the mic to Ding Pajaron, Director of Development at Aapi Community Health Center, to shed light about the importance of the work that our AAPI CBOs are doing and providing, and why it's so critical that our community-based organizations, continue to provide these culturally relevant and language accessible services to meet the needs in our communities. So Ding, I'll pass it over to you.
Thank you, everybody. Thank you, Lakshmi, and thank you to all for attending this briefing. For some of you, you may have encountered you as Gertrudes. That's my formal name, so I just wanted to make it clear. But I want to put that premise in the context of Aapi's history, because I know that many of you are new to us. Aapi Community Health Center grew out of a collaborative effort of activists from the Asian and Pacific Islanders community and the Native American communities. And they called on the Federal Health and Human Services to disaggregate data in HIV/AIDS surveillance for their respective communities. Data lumped under the category others, which we were in 1989, meant no funding for life-saving services. That successful advocacy led to the establishment of comprehensive, culturally competent HIV/AIDS services done in partnership with community-based organizations. Many of them are still around, and we're happy. We're still working with them on getting the services together to the communities. And partnership also with private and government funders, including the City Council. That model became a nationally recognized and served as foundation for our subsequent expansion to general primary care beginning in 2010. 6 years ago, Aapi, out of a desire to sustain our important HIV/AIDS services to our communities, we applied to become a federally qualified health center, and we were designated an FQHC, that's why I call it a health center, in 2010. And so we joined the ranks of safety net providers in New York City. This transformation allowed Aapi to expand its services to medically underserved and marginalized people from all communities of color, immigrants, LGBTQ, and other people living with HIV and their affected families. Our services today include general primary care, HIV primary care, mental health services, women's health services, care management, screenings for HIV and STIs, nutrition education, community education, mentorship for API, LGBT youth, and many others. Our reputation for compassionate quality care draws patients from all over the city. So we have footprints in most of New York City. Aapi is located currently at 400 Broadway on a 4-story leased building. We also conduct health fairs in various parts of the city, often in collaboration with community-based organizations. Just a quick look. I'm bringing this up because this data came from the period of COVID, and as an essential provider, we never really closed. We immediately, installed telehealth modality in order to accommodate patients who could not come to our clinic. but our clinic remained open throughout the pandemic. We directly serve from the period of June 20 to July 2020 to July 2021. We serve directly over 6,400 patients. And these highlights of the demographics of these patients is 66% communities of color, 19% API, 20% Hispanic, Latinos, 18% Black, 60% were low income and poor, 64% LGBTQ, 21% people living with HIV, of whom happily we're doing good with the viral load suppression. So it's 87%. 27% identify as trans. And in addition to direct services, we conduct digital and in-person outreach, and we reached 800 upwards of 800,000 people reached through our community health education. Aapi built its programs and services around the principles of cultural competency and our commitment to a safe space. We do our best to help patients overcome huge barriers to healthcare, language especially, in a community that has 100 or so languages, is very important. And we do this not only by hiring people from the community, but we do our work in conjunction with community-based organizations that are currently in existence. We also, because of the need as a medical provider, it's important that the diagnosis is accurate. You cannot rely on translation from your grandmothers in order to get the services. There's also the question of many of our patients need the safety, confidentiality of their situation because of the stigma of HIV. So we in addition to our staff, if we cannot handle it internally, we have access to a professional translation service that allows our providers to provide the services. So in addition to the barriers like language, we have to deal with the trauma due to discrimination because of their sexual orientation, because of HIV status, because of their skin color. And on top of this, pre-pandemic traumas, add COVID-19 trauma to the list. As you can see, many people will be discussing around our anti-hate crimes that had arisen during this period. So so as I mentioned, we immediately went into telehealth, but in this period of COVID pandemic recovery, and I'd like to think that we really are in this period of recovery, the availability of COVID vaccines in mid-2021 allowed us to pivot towards that aspiration. At this point, because of the ongoing Omicron variant still menacing us, it's an aspirational thing, but we intensified our outreach to bring back patients whose healthcare services were disrupted because of the pandemic. We are doing our outreach through digital medium as well as pop-up health fairs in neighborhood where community members can be easily reached. We want to continue to partner with you on those activities. In Manhattan, we are expanding.
I'm so sorry. I hate to cut you off and jump in, but I'm noticing that we're running tight on time. So I was wondering if you could.
I will just close out by yes, we want to continue providing that services, and I look forward to have further discussion on this later. Thank you.
Thank you so much, Thing, for providing so much detail about the work that Aapi is doing, especially during this time, with the heightened needs that we're seeing in terms of health access in our communities. The work that you all are doing is extremely vital and important, and it really speaks to the level of need of our community-based organizations. I wanted to now turn things over to Manyak to talk about, to shift gears and talk about the sense of need and the difficulties that many of our groups have experienced in terms of being included in the discretionary funding process, and why we've come together as 18% and growing now more than ever to fight for this AAPI community support initiative so that our groups could be more equitably funded by the city.
Thank you so much, Lakshmi. Hello, everyone. My name is Manyak Yu. I'm the Executive Vice President and Chief of Staff at the Academy of Medical and Public Health Services. We're a nonprofit organization based in Sunset Park, working on promoting equitable health and wellness for Latino, Chinese, and Arab communities in South Brooklyn. COVID-19 has highlighted the importance of wraparound services that we provide. For the past 12 years, our organization, AMPS, has offered health screenings to address the lack of preventative health care, mental health therapy to address exacerbated mental health conditions of our communities, and regular social services, adult literacy services, which during COVID-19 has created a sense of community and helped our communities prepare for re-entering the workforce. Like many groups on this call, we also jumped in to offer emergency food response services, digital literacy, COVID-19 response, and at the heels of the tragic hate crimes against the AAPI community, we are working hard to respond through the provision of safety zone planning with businesses, safety accompaniment programs, and self-defense, upstander, and bystander intervention trainings. For the past 5 years, we have been working with the 18% and Growing Coalition to advocate for a fair and equitable distribution of initiative funding for the fastest growing population in New York City. And during this time, our community has consistently been invisibilized. One of the examples is digital literacy. While many of our community organizations have received adult literacy funding, it does not cover the wraparound services that allow us to support the students remaining in the program, such as social support services and regular case management and follow-up. Nor does it cover the additional investment we must take to educate community members in digital literacy to help them to remain in programs, that have transitioned into the remote environment as a result of COVID-19. And despite groups like AMPS continue to offer digital literacy programming to fill this service gap for seniors and immigrants, like classes, counseling, and even device loans, allowing them to be able to access critical social services like HR programs, where applications are also digital. We have continued to see a lack of investment in AAPI serving organizations. And just to put this into scope, in the last fiscal year, only one AAPI organization was funded for digital literacy. And as we mourn the loss of Michelle Lissigo and Christine Lee, we know that our communities will need to expand our social services and mental health services, in addition to education, to address the increasing stigma, the mental health stigma to seeking help. The process of sustaining clinical programming is difficult and expensive. And as demand continues to rise, we continue to receive requests for support from our uninsured communities. AMPS is one of the few organizations who offer targeted mental health support for undocumented and uninsured immigrants who are turned away from mainstream healthcare organizations. In last fiscal year, only 6.87% of organizations were funded of AAPI organizations, funded for mental health services for AAPI. Other initiatives that have similarly been lacking in AAPI investment, despite increased rates in need for social services, violence intervention and prevention, food access, and mental health services, include criminal justice services and food initiatives. Last year, AAPI serving organizations only received 2.86% of funding for criminal justice services, 1.45% for food initiatives, even though when we offer our food pantry, we see lines of Asian seniors wrapped around the block. We received 6.07% for health services, 1.58% for immigrant services, and 2.43% for public safety. The API Community Support Initiative was a historic fund that allowed many API groups to fill this funding gap. And we are extremely grateful that this fund has allowed us to expand current programming to help us meet the growing needs. However, many of our groups still are unable to fully meet the funding needs proportional to the work that we are doing. The work is being done, but the need is not appropriately met. And we urgently need continued and expanded investment in the API community that's proportional to the significant growth and growing needs in the API community. We appreciate all of you for joining this call today, and we hope that we can continue to have your support as we advocate for additional investment in API communities for all of these initiatives, and particularly an increasing support for the API Community Support Initiative.
Thank you so much, Manyak, especially for breaking down those numbers and really illuminating how difficult it is for our groups to be included in the discretionary process, despite the fact that we are continuing to do work to address these issue areas with or without council's support. And it's been an extremely difficult endeavor to achieve on our community's ends, and it continues to be more difficult, especially during this time. I want to now pass the mic over to Jihei Fisher, the Executive Director of KFSC. I think, Jihei can really speak to something that we hear a lot from our groups in 18% and growing. We come together for planning meetings every month to touch base and see, what are the needs on the ground and how can we come together and strategize as a collective community. And something that many of our groups have been experiencing, is difficulties around transparency and understanding the discretionary process, how to apply for funding, what initiatives to apply for, and how to actually be included in the budget process. And so I think Jihei, more than anyone, can really speak to this. So I'm going to pass the mic over to her.
Thank you, Lakshmi. Hello, my name is Jihei Fisher, Executive Director of the Korean American Family Service Center. Thank you, CACF, for holding this briefing and panel discussion. In the last 33 years, KFSC has been serving immigrant survivors of gender-based violence. And I think some organizations are more familiar with city funding than others, but overall, as Lakshmi said, we could all learn and better understand how decisions of the funding amounts are determined. We have some context and knowledge on the process of how the funding amounts are determined. Like we know that the size of the organization or the years of experiences in receiving city council funding are some factors, but we could all benefit from understanding a larger context of the budget decision-making process. I want to give you a very specific example that KFSC has been experiencing over the years. So we receive DOVE funding, DOVE initiative funding for some time. And DOVE is the Domestic Violence Empowerment Initiatives, and it's the New York City Council's primary investment in strengthening the response to the domestic violence in communities across New York City. But the amount of DOVE funding to the respective district is determined based on the number of DV incidents reported to the police. But we as an organization that's doing the groundwork, we know that many of these incidents are underreported because of the language capacity or cultural challenges. By contrast, the call volume to our 24-hour hotline, the bilingual hotline, has increased by 300% since the pandemic. And that number does not reflect on the police reports. So this means that we are minimizing our community's needs without fully reflecting the reality of the immigrant survivors we're serving in our community. So we ask all of you, for increased transparency of the City Council's budgeting and allocation process to ensure that the larger representations of the community we all serve together and the distribution of the funding to culturally specific groups are equitable across the board. Thank you. I know we don't have a lot of time, so I'm gonna wrap up here, but thank you. And we look forward to further discussing this with everybody.
Thank you so much, Chihei. I think the Dove funding is a really great example about this like need for transparency, because for the longest time, our gender-based violence intervention and prevention groups were trying to understand why certain groups were and were not included in the Dove funding and how that funding was being allocated. And it took us years of reaching out and emails and meetings and conversations to get a clear answer about how that funding is broken down. And then we realize that the way that funding is being analyzed is not actually inclusive and understanding of our community and the levels of our needs. And so that's an important conversation that we've been trying to have with council about changing the way that that Dove funding is being understood and allocated out. I see that we're short on time, so I just wanted to ask all participants, if you have any questions about anything that our panelists have shared so far, please feel free to put your questions in the chat. And if we have time at the end, I will make sure that we try to answer these questions. But if not, we will reach out via email to make sure that we can answer your questions still in written text. I'm now going to turn things over to Dia from SUPNA NYC to speak about another issue that many of our groups have been experiencing, which is contracting challenges. So Dia, over to you.
Sure. Thank you, Lakshmi. I'm Dia Basisen. Good afternoon, everyone. And thank you to CACF for bringing us all together today. I think my colleagues prior to me outlined really effectively how necessary investment in API CBOs is, particular right now. And none of us really closed our doors in this pandemic, and that hasn't been without challenges, including the contracting process. I think we're always talking about budget justice, but I think when we're asking for true budget justice, it means not just looking at ultimately who got funding, but also examining the entire contracting process. Right? The city and council look at applications, trying to make choices that are equitable while meeting the competing needs that exist. But what so often isn't looked at or thought about is which organizations aren't even applying for funding because the barriers to inclusion are too high. The reality of the contracting process for the council and many other agency contracts is that the length of time between being actually awarded a contract, then registering that contract, and then finally receiving reimbursement for the expenses incurred is often astronomical. This precludes smaller organizations from applying for discretionary funds, even though this funding could have been transformational for their organization. To give you one example that SUPNA has experienced, as well as I know many of our partners on this call, is the Access Health Initiative managed by DOHMH. Many groups are still waiting for reimbursement for expenses that were incurred over 2 years ago at this point. That means that services that were provided to the city in fiscal year 20 sometimes aren't paid until fiscal year 22 or even later. Right? How can we say that the discretionary funding is inclusive when the price to apply for some of these initiatives is needing to already have that money sitting in your bank? Because as a CBO, right, we can't go 2 years without paying our staff. Right? And there are several organizations that have chosen not to join Access Health, again, because of these contracting issues. Right? And then on top of that, right, these contracts are all reimbursement based. So that in itself is already challenging for newer and smaller organizations. But even for somewhat more established organizations, whether we can afford to not be paid for months or even years after the work is done is a serious consideration. Right? The biggest roadblock seems to come at contract registration. By the time the requests for documents come, the year is well underway, and then it can be unclear who the right contact person is for a particular contract. We're asked for the same documents multiple times, sometimes by multiple people, even though they may have already been uploaded to HHS Accelerator or to Passport. For small organizations where the same person is responsible for finances, development, management, and more, fielding all these requests in itself can be onerous. Right? Once a contract is finally registered, it doesn't necessarily mean that the payments start coming right away. it can actually be quite a long time between when invoices and supporting documentation are sent and when the organization actually receives payment. Right? When we think about budget justice for New York City, it's important to look at what groups we're funding and the implementation of these contracts down to when the organization actually gets paid for work done. Right? The system as it stands makes it difficult for smaller immigrant-led organizations to get funding for truly critical work, reaching populations that are otherwise left behind. Right? We're grateful to the increased investment that the council made in the AAPI community this fiscal year, and we look forward to building on that and working together for an equitable COVID recovery.
Thank you so much, Dia, for speaking on this. And I think you said something really powerful when you mentioned that, there are a lot of groups out there that are not even applying for discretionary funding because the barriers to inclusion are so high. And I think that actually is a perfect segue for Lily from NAPOF to speak about another key barrier that's making it difficult for our groups to access and be a part of discretionary funding, and that's language access issues. And so I want to turn things over to our final panelist, Lily from NAPOF. Oh, I think you're still muted, Lily. Oh, perfect.
Thank you, Lakshmi. Hello, everyone. My name is Lily Liang. I am the NYC organizer of National Asian Pacific American Women's Forum, NAPOF, New York chapter. NAPOF is a national organization for AAPI women on reproductive justice and economic justice. And our New York chapter recently launched a campaign called Language Access / Budget Justice, based on surveys that we did in AAPI communities in Brooklyn and Queens. We found out that folks are very, very frustrated with accessing NYC public benefits, as well as other social programs like senior care, youth development, and so on, just because of language barriers. And as you may know, that the translations on the government agencies' websites are not legible, and we have identified many translation errors. Because time constraint, I'm not going to identify them here. So if you want to get someone from the government agency to help to overcome the language barrier, it's nearly impossible. We called HRA, asking them if they can help with the people with limited English skills to fill out the confusing forms. They directed us to the larger community-based organizations like American Chinese Planning Council or Asian American for Equity. These large organizations are already overburdened with this type of service with little money, like 20 grants for sending up 10 grant people. Basically $2 per person. I don't know if any government agency is willing to provide a service with this pay rate. And meanwhile, there's a large amount of smaller AAPI organizations who have the potentials to provide the services are not funded at all. Yeah, we have a list of like over 24 organizations across the board in Queens and in Brooklyn. Most of them are even not aware there is a funding opportunity, and they didn't heard like discretionary funds before. If these organizations, they're mostly first generation led, bilingual, and closely related to the communities where they located. So if these AAPI, smaller AAPI organizations are funded, the community members will have more resources to rely on. They have like more channels open to them. I mean, either it's a food stamp or Medicaid or senior care or youth development, they have more resources. So We hope that the City Council can conduct some outreach to these smaller API organizations, give them some guidance, especially the application process in Passport and HHS Accelerator, help them get on track to better serve the community members. Thank you.
Thank you so much, Lily. I think oftentimes we talk about language access issues for our communities, and we don't reflect on the fact that a lot of our organizations and our organizational leaders are also navigating issues of language access that make it especially hard for us to inform and to support our community members in terms of social service navigation. So I'm really glad that you spoke to that. I just wanted to share that we're going to be.
Hi, everyone. Sorry. My name is Inés Lanuez, and I'm from Grand Street Settlement. So since we're talking about resources, I just wanted to bring something up there. So how do we get like some information on minority-owned women businesses certified? So I noticed that recently, like a lot of the contracts that we receive, they are calling us to spend a certain percentage on those businesses, but it's very hard to find resources on them. So I do not know if the network know of any organizations that are certified as minority-owned women businesses.
Thank you so much for your question. I'm so sorry. Because of the time constraints, we're going into breakout rooms right now. I don't think we'll have time to address any participant questions out loud right now, but I please urge everyone, if you have questions, to put them in the chat. You can also put them in the breakout group chat, and we'll be following up via email to address all of your questions. Nora, I also saw your question about the Schedule C data, and I just wanted to quickly mention that the graphs that I shared don't discuss the data from all citywide initiatives, but the actual Schedule C report does go into the citywide initiative data as well. And we'll be sharing that Schedule C report after this briefing. But now I wanted to turn things over to our borough breakout rooms. And so we'll be breaking out based on the borough that your office is located or that you serve in, so that we can have more tight-knit, closer community conversations about some of the things that we've discussed here today, and also other issues that we're seeing.
So you will not see the breakout room pop up. So please click on the breakout room icon or the breakout room button at the bottom of the control panel on your Zoom screen, and click on the borough for which your office is located or your organization serves. If you need any help or you cannot join on your own, please let us know in the chat and we can help you.
I see that we have just about 1 minute left, and I don't want to run over. So I just wanted to share some key dates and upcoming actions for CACF and 18% and growing over the next 2 months. So on Wednesday, March 2nd, we will actually be having a briefing in partnership with NYU CISA and CPC around our NYC COVID Turner report. And that briefing is March 2nd from 10 to 11 a.m. And then at the end of March, we will be having our City Advocacy Week. That will be virtual and week-long from March 28th to April 1st. And we'll be having, legislative meetings, Twitter storms, a digital photo story campaign on our social media platforms. And we invite all council to meet directly with the groups who make up 18% and growing and who are serving directly in your district during that week. So yeah, these are some key dates that I just wanted to share with everyone. I'll also be sharing these dates out and these slides out post the briefing. So don't fret if you can't memorize all this. And then lastly, I just wanted to share my contact with you all once again. If you have any questions about anything discussed today at the briefing, our Schedule C report, our upcoming community events, the 18% and growing campaign at large, if you'd like to schedule time to meet or anything like that, please feel free to reach out to me either by phone or email. And once again, thank you so much for coming out today and attending our briefing. And I hope to see you again.
Thank you, everyone.
Thank you. Bye.
Thank you. Bye.
Thank you so much. Bye.